If you're one of the over 67 million Americans who rely on Medicare for their health insurance coverage, you're likely wondering what changes are coming to Medicare in the years ahead. And this is completely understandable. Now, every year there are changes and proposed changes as well. However, it is looking like 2026 and the years thereafter may have the biggest changes yet. So in today's video, let's discuss some of these proposed changes so that you can better prepare for the years to come. Now, whether you're currently enrolled in a Medicare plan or you're planning to enroll in Medicare in the years ahead, there's a lot to unpack here, so make sure you stay tuned to the end of the video. So let's start with the basics. There are basically two different paths when it comes to Medicare. You can either opt for Original Medicare, which is entirely federally funded and federally run, or you can opt for Medicare Advantage, which is federally funded. However, it's actually run by private insurance carriers. With Original Medicare, there is Medicare Part A, which is going to cover your hospital costs. Then there's Medicare Part B, which is your medical insurance. It's basically any time you see a doctor. Medicare Advantage is a replacement for Original Medicare. And then there's Part D, which will cover your prescriptions. Remember that Original Medicare does not offer additional benefits like dental, vision, hearing, or prescription drugs. However, many Medicare Advantage plans do. Medicare Part A will also cover recovering in a skilled nursing facility care. Now, this is not to be confused with long-term care. Skilled nursing facilities are designed as a place where you can recover from an inpatient procedure and receive habilitative or rehabilitative services. You must receive skilled nursing care at the skilled nursing facility. Long-term care for something like dementia or Alzheimer's would not qualify and is not covered under Original Medicare. Additionally, many vaccinations are covered under Part B. Additional vaccinations can be covered under Part D. Things like chemotherapy and certain oral anti-cancer drugs would be covered under Part B, but your more regular run-of-the-mill prescriptions for something like blood pressure or cholesterol would be covered under Part D. Part B will also cover diagnostic services and imagings, MRIs, x-rays, lab work, etc. So first I want to focus on Medicare Part D. There have been some huge changes in recent years, and of course some of the more planned changes for 2026 and beyond. For example, in the past, Medicare Part D had several stages which were very complicated and very frustrating, including the unfortunate donut hole, which would lead you into the catastrophic coverage phase. At that point, you would be responsible for a copay, but a much, much smaller copay. However, in 2025, your spending was actually capped at $2,000. Now, of course, this is only for prescriptions that are covered in network pharmacies on your plan's formulary. In 2026, that threshold will increase ever so slightly to $2,100. Now, this has been extremely controversial because many people felt that by imposing this threshold, copays and coinsurance would go up to offset these costs. So, as I said, it's been very controversial, and something else that has been rather controversial, although largely positively received, is the ability of the federal government to negotiate certain drug prices. This is new for 2025. Basically, the government has never had any say in those prescription drugs that were more common for those on Medicare. However, every year now, the government is going to negotiate more and more drug prices. In 2026, the prescription drug list will expand further for those negotiated drugs. The negotiations that will take effect in 2026 are for Eliquis, Jardiance, Xarelto, Januvio, Varziga, Entresto, Enbrel, Imbruvica, Stelara, and Fiasp. And in 2026, there will be more negotiations for 2027. Those proposed drugs would be for Ozempic, Rybelsus and Wegovy, Trelegy Ellipta, Exanti, Pomalyst, Ibrance, Ofev, Linzess, Calquence, Austedo, Breo Ellipta, Tradjenta, Xifaxan, Vraylar, Janumet, and Otezla. Wow, these names are really something, but I think I got them all right. While we're discussing Part D, let's also talk about those oh-so-popular weight loss drugs. You've heard them, you've seen them, Wegovy, Ozempic, they're everywhere. Unfortunately, they are not covered by Medicare, at least not for weight loss purposes. However, there is a proposal to include these drugs for weight loss purposes in the years to come. These drugs have been expensive and could potentially have long-term side effects. However, for those struggling with their weight, especially in older age, this is going to put stress on your joints, stress on your heart, your cardiovascular system, etc. So these could possibly be life-saving medications. If they're not covered by Medicare, they could be financially prohibitive. This is definitely controversial, and we'd love to hear your thoughts in the comments below. Now let's switch gears and talk about Medicare Advantage, which in and of itself is already a divisive topic, with strong proponents for Medicare Advantage and strong critics against it. One of the biggest issues with Medicare Advantage is undoubtedly the issue of pre-authorization. Pre-authorization leads to delays, possibly denials, and much more paperwork for you as the beneficiary. Unfortunately, the issue of pre-authorization is largely attributed to why so many doctors and hospitals simply do not want to contract with Medicare Advantage plans, which leads to a secondary issue with Medicare Advantage plan, which is that their networks can be extremely restrictive. In 2026, CMS has some proposed changes for the pre-authorization process. They propose requiring electronic systems for faster approvals, making approvals valid for the full course of treatment, and requiring insurers to give clear reasons when they deny coverage. These changes could essentially reduce care delays and give patients and doctors much more peace of mind. Medicare Advantage plans have become extremely popular in recent years. In fact, over half of those who are enrolled in Medicare are actually enrolled in some type of Medicare Advantage plan. But there are issues. Medicare Advantage spending has far outpaced original Medicare. And that's why CMS is proposing a crackdown, with stronger reporting on how much Medicare Advantage plans actually spend on medical care, and rules on AI use to prevent discrimination or biased care decisions. Now we have a video, actually several videos, which I will put at the end of this video, dedicated to the pros and cons and similarities and differences between original Medicare and Medicare Advantage. And there is a reason that most of our clients actually choose original Medicare plus a Medicare supplement plan. It just affords you much more flexibility. And as we age and our healthcare needs become more extensive, I cannot put enough emphasis on how important this flexibility is. However, as I mentioned just a few minutes ago, more than half of those enrolled in Medicare actually choose a Medicare Advantage plan. And that is because at face value, they just seem more cost-friendly. Now, that's not always the case when you actually break down those costs. However, there's a reason that more people are choosing Medicare Advantage. So there's actually been some discussions to make original Medicare more competitive so that it can compete with Medicare Advantage, ideally by adding some of those additional benefits offered by Medicare Advantage, things like dental and vision and hearing. These are very important benefits at any age, and it really is a travesty that original Medicare does not include them. So there are yearly discussions to beef up the coverage of original Medicare, and we'll see how that goes in 2026. I mentioned marketing and how ubiquitous Medicare Advantage marketing is. Now, in recent years, there have been major and wonderful changes to some of the predatory natures of these marketing tactics, but it is proposed that there be further changes for marketing tactics as well. For example, a crackdown on deceptive practices, more transparency on some of those additional benefits like dental, vision, hearing, prescription drug, possibly transportation or fitness benefits, making sure that those benefits are actually usable, and improving plan comparisons so beneficiaries can make more informed decisions. Of course, if you'd like assistance making an informed decision, we highly recommend that you work with a broker. If you'd like our assistance, you can reach us in the comments below or at the number on the screen. There's absolutely no charge for our services. We are licensed nationwide, and we are more than happy to help. Of course, we do release these videos on a weekly basis, and as I mentioned earlier, I think there's going to be more changes than ever before, so please make sure to subscribe to stay up to date, and make sure to like this video so we can get this information out there. Now, although there are many critics of Medicare Advantage plans, there are many proponents of Medicare Advantage plans as well. And it's even been proposed that Medicare Advantage become the default option for Medicare beneficiaries. Proponents for this argue that this would remove big government from healthcare and also allow people more options with their healthcare coverage. However, critics warn that this would further privatize Medicare and could undermine patient choice. This could also trap beneficiaries in a Medicare Advantage plan, more on that in just a minute, and possibly further and faster deplete the Medicare fund. Now, when I say trap beneficiaries in a Medicare Advantage plan, that's because it can be very difficult to switch back from Medicare Advantage to original Medicare with a Medicare supplement plan. Medicare supplement plans, as I mentioned earlier in the video, are just a financial solution. They fill in those out-of-pocket costs. However, it's really in your best interest to enroll in a Medicare supplement plan in the initial 6-month window after you turn 65 and enroll in Part B. During this time, you will not be subject to medical underwriting. That means that you cannot be charged more or denied based on your health. Should you choose to enroll outside of that 6-month window, in most states, you can be charged more, you can be denied entirely. But there are some more big changes coming in 2026 to those rules. Some states already have what's known as the birthday rule, which is basically every year around your birthday, you had a period of time in which you can enroll or switch into a Medicare supplement plan without medical underwriting. However, there are many rules and regulations surrounding this switch. There's also what's known as an anniversary rule, which basically operates the same way as the birthday rule, except it surrounds the anniversary in which you enrolled as opposed to your birthday. There are also states that will offer you more flexibility, the option to change and enroll year-round without any type of medical underwriting. In 2026, there are more states that are looking to expand their Medigap enrollment and make it more accessible. We've got a video dedicated entirely to that, which goes in further depth. I will put that in the description below, but it's definitely something that you want to look into. Medicare supplement plans are a great option. However, as I mentioned, if you enroll outside of that 6-month window, they may not be an option for you anymore. You want to know whether your state is looking to expand their enrollment, if your state already has expanded enrollment, and make sure that if you are choosing to put off enrolling in a Medicare supplement plan, it's not something that you're going to regret further down the line. These are just some more of the changes that could be happening in 2026. If you want to learn more about Medicare Advantage versus Medicare supplement plans and original Medicare, I'll put that video for you right here, as well as our All About Medicare playlist. You can learn more about Medicare in general. If you have questions, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers and we're licensed nationwide with absolutely no charge for our services. As always, please make sure to like and subscribe. We'll see you next time.